Hi, welcome to the Hot Pot. I'm your host, Linnea Kimball. Today we're talking about clinical research. For some people, those two words can bring up a lot of feelings. Uncertainty, distrust, or simply, that's not really for me. But when our communities aren't represented in clinical research, the medicines and treatments being developed may not reflect our needs or our bodies, and that has real consequences for our health. Today, we're breaking down what clinical research actually is, why representation matters, and we're shining a light on IgA nephropathy, or IgAN, a rare kidney disease that disproportionately affects Asian American, Native Hawaiian, and Pacific Islanders, or AANHPI, and that too many people in our community have never heard of. I have two wonderful guests joining me today. First, Dr. Nguyen, a physician and principal investigator at Houston Methodist Hospital. Dr. Nguyen, welcome. Can you share a brief introduction and tell us more about the work that you do?
Surely. First of all, thank you for having me. My name is Peter Nguyen. I am a nephrologist. I'm the director of the Division of Nephrology at Houston Methodist Hospital in the Department of Medicine. I oversee the clinical and the academic mission of the division. I am a busy clinician. I still take care of a lot of patients. Additionally, I'm also a principal investigator in a couple of trials. So I feel especially honored to be able to speak on behalf of clinical trials today.
Great, thank you. Great to have you. And
Thank you.
also joining us, we have MK Farmer, Senior Medical Director in Clinical Trials at Takeda Pharmaceuticals. MK, welcome. Can you also share a little bit more about yourself and the work that you do?
Absolutely. Hello. Thank you so much for the opportunity to be part of this podcast today. My name is MK Farmer. I'm a rheumatologist or immune system physician by training. I help design and implement clinical trials in rare diseases, and I get to work with lots of talented people around the world to execute these trials.
Thank you. Great to have both of you. So let's start with the basics. What is clinical research? People hear a lot of words: clinical research, study, trial. In simple terms, what do these words mean in plain language? Why don't you let us know more about clinical research, Dr. Nguyen?
Thanks. Clinical research means research with people. A clinical study is when researchers learn about health, tests, or treatments. A clinical trial is a type of study that tests a treatment, like an investigational medicine, with real people and patients. Usually those who have been diagnosed with a disease or condition that the investigational medicine was designed to treat. People use these words in different ways, but the big idea is the same. It's a careful, planned way to learn and try to improve care.
Thank you. And why is clinical research important, especially for new medicines?
It's important because it helps us learn what is safe and what works. Clinical research is a required step before many new medications can be approved for broad use. It's how we move from "we hope it helps" to "we know how it helps," and we know the risks based on the reaction and the responses seen in the controlled clinical study.
You know, some people in our communities feel nervous about research. What protections exist today for people who want to join a study?
Those concerns are understandable. Today, studies follow strict rules to protect people. Safety is not only the top priority, it's the first priority. Participants are monitored, and the study team checks in often. Trials don't move forward unless everything is safe.
Do you have anything to add, MK?
Yeah, I think that there are also oversight groups independent of the sponsor of the study, and then those healthcare professionals conducting the study that review the studies before they start, and they watch out for safety concerns throughout the study.
What about a placebo? Oftentimes, I think people have heard this term as related to clinical research. What is a placebo?
So, a placebo is a look-alike treatment with no active medication. It's used so researchers can tell if the investigational treatment truly works. Even if someone gets a placebo, they still get full care and they are never denied needed treatment. It's actually an essential tool used in clinical research to help find out what really helps patients.
And what about informed consent? This is another term I hear a lot when it comes to clinical research. What does that actually mean for someone who's considering participation? Dr. Nguyen?
It means you get the information you need before you decide. It gives you all the options, what may happen, possible risks, possible benefits. You get the opportunity to ask questions, take time to think, and even say no if you would like. Additionally, if you join the study, you can still opt to stop later. It's always your choice.
That's great to know. A lot of people in the AANHPI cultures have family involved in their health decisions. How does clinical research accommodate family involvement in the decision-making process?
That's a good question. I can tell you that many people in this culture really lean on family. You can bring any family member to listen and help ask questions. Good care and good research should make room for your family and your questions.
I think that would probably make a lot of communities feel better. Now I want to talk about diversity in clinical research. Why does it matter who joins a clinical study? For a long time, research mostly studied whoever was easiest to reach. Why isn't that good enough? MK, do you have thoughts on this?
I do. If studies don't include many kinds of people, we may not learn how well a treatment works for everyone. Diversity helps make results more like the real world. It helps doctors understand benefits and side effects across people from different ages, lifestyles, backgrounds, and more. That's why clinical studies should include participants who reflect the people that live with the disease.
So you're saying medications can work differently in different people based on their genetics or their background?
Absolutely. People can respond differently for many reasons: genes or genetic makeup, age, other health conditions, other medications, and even lifestyle factors. That's why it helps to have many different people in research. It makes the information stronger.
What happens when our community isn't included enough in research? What are the participation rates for AANHPIs in clinical trials?
Good question. When AANHPI communities aren't included in research, we lose out on important information that truly reflects our health needs. Right now, less than 1% of NIH-supported clinical research focuses on AANHPI participants. That means fewer answers, more uncertainty, and sometimes slower progress in understanding what treatments work best for our community. When more people from the AANHPI community take part, research becomes more accurate, more inclusive, and better able to serve real patients.
What would you want someone to remember if they're thinking research isn't for me?
I'd say you deserve clear answers and respect. You can ask what support exists, what visits are needed, and what your rights are. Participation is always your choice, but learning about them can be empowering.
With such a low participation for AANHPI communities in clinical research, I wonder about what some of the challenges are to being involved. I want to start with something many in our community have witnessed directly, and that's language access. Dr. Nguyen, how do you see language affect clinical research participation? What should someone ask for so they can truly understand?
I think this is a great question. This applies not only to clinical trials, but also to patient care. I think, first of all, that's why having family around is helpful. And while they shouldn't be used for interpretation, just having family that can help bridge some understanding is very, very important. More specifically, though, you can ask for an interpreter in translated materials. You can also ask for things to be explained more simply. You should never feel rushed. You should never feel overwhelmed. Understanding is the priority and is the first part of safety.
And then there's also cultural considerations around illness itself. In many of our communities, there can be stigma around being sick or a sense that illness reflects poorly on the family, what some call loss of face. MK, from your work in clinical research programs, how do the cultural factors influence whether someone considers participating and what can be done to address them?
That's a really great question. Privacy is important. Teams should explain how personal health information is protected and who gets to see it. Results from clinical studies are combined across all participants so that no one individual participant is identified. They should also create a respectful space, no judgment, no pressure, so that people can ask questions without fear.
Another dimension I want to explore is the intersection of traditional healing practices and Western medicine. Many of our community members still use traditional remedies or see traditional healers or integrate different healing modalities. Dr. Nguyen, how should people think about clinical research in relation to their traditional health practices?
That's a great question. Many people in this community rely on traditional methods. Clinical research isn't meant to replace those practices, it just adds another option. It can help us understand conditions like IgA nephropathy and give our community more choices. You can keep your traditions and still use research as another tool to support your health. It's very important to tell the study doctor about everything you take: herbs, teas, supplements. This way, the team can check for safety and avoid harmful interactions that could occur between traditional medicines and an investigational drug used in the clinical study. Ultimately, it's about keeping you safe.
Now, we also need to acknowledge the structural challenges. Beyond culture and language, what are some of the logistical or systemic barriers that make it harder for our communities to participate? And what is the research community doing to address this?
Practical barriers, time off work, transportation, cost, these are real issues. Many studies provide study-related tests and study medicine at no cost, and some may offer help like travel support or meal support. People should be comfortable asking what costs are covered and what support is available.
Now, we've been talking about IgA nephropathy, but for our audience, let's dig a little deeper. Let's talk about what this is, IgA nephropathy or IgAN, and what our community should know about it.
IgAN is a kidney disease. It happens when IgA-related proteins build up in the kidneys and cause damage over time. It matters because it's reported more often in East Asian populations, and in the United States, Asian Americans have some of the highest reported rates of IgAN.
One phrase that really stuck with me when I was learning about IgAN is it's an invisible burden. People living with this condition are carrying something that others can't see. Can you talk about what that means for patients?
It's a really important point. Many people don't feel symptoms at first. When symptoms do show up, they can include blood in the urine, foamy urine, swelling in the legs, high blood pressure, and feeling very tired. If you notice these, it's important to talk to a doctor about these.
And so, how does clinical research connect to IgAN? What's one simple next step if someone wants to learn more without feeling pressured?
There is no cure yet for IgA nephropathy, so research is very important to find better ways to slow down kidney damage due to IgAN, as well as improving care. A simple next step is to ask your doctor what tests or next steps make sense for you. If you want to learn more about research opportunities in general, you can also look up weconnectpatients.com to explore educational information and possible studies. No pressure, just learning.
Thank you for sharing those resources, and thank you for joining me, both of you. Thanks for having this important discussion about clinical research and diversity in clinical research. And thanks for sharing more about this rare kidney disease, which disproportionately impacts AANHPI communities. And I'm imagining that many of us have not heard of this. So I hope that people will take the time to learn more about this health condition and also learn more about clinical research in general, and how you might want to participate and make sure that our voices and our bodies are being counted in the research. Thank you.
Thank you for having me.
And thanks so much.